Welcome to the Ahaki podcast. On this series, we take a deep dive on the litigation of sexual reproductive health and rights cases in Africa, hearing from the different experts across the continent on what really means to litigate these cases. On this particular episode, I am privileged to host Dr. Godfrey Kangaude, who is the founding member of the Nyale Institute. He has done amazing work in areas of litigating issues on sexual reproductive health and rights. Dr. Godfrey, you're very welcome. Karibu sana. Welcome to the podcast.
Thank you. Asante sana. Is that what you say?
Yes.
Okay, good.
You know some Kiswahili?
A little. Asante sana.
Welcome. The Nyale Institute is based in Malawi. Tell us about it.
Okay, so Nyale Institute is an NGO based in Malawi, specifically in Blantyre. And our mission is to advance sexual and reproductive justice by strengthening our collaboration with government and stakeholders. So that is what...
and that's a very tricky subject there.
When anything to do with sexuality and reproduction can easily become tricky, yes. So we're talking about the issue, for instance, termination of pregnancy. We're talking about consensual sex amongst adolescents. We're talking about all these kind of issues, maternal health issues, which can become tricky because usually they have traditionally been in the private domain. So public interest litigation brings them in the public, exposes things that maybe people are not so comfortable with, but it's necessary.
What has been your experience practicing this, like trying to create those synergies between the public and government on such sensitive issues of sexual reproductive health?
Yeah, well, I think it's to convince the public that these are necessary things to address, because sometimes it's just a fear of the unknown. All right? Now, if this comes to the public, for instance, termination of pregnancy, if it comes to the public, people fear that, something wrong is going to happen. And yet we're talking about the life and health of a person who is pregnant, who wants to keep the pregnancy, and sometimes a person who doesn't want to keep the pregnancy. But the issue is about health and their life. So when we bring it like that, some people are like scared already. But we're saying, no, let us bring it to the public. Okay? Let the laws that regulate this be clear and be aligned to human rights, because at the end of the day, we are talking about the life and health of that woman.
And of course, that work the work that you do has been, in a way, affected by the legal and policy framework around key issues on sexual reproductive health and rights in Malawi.
Yeah.
How have you been able to navigate this legal environment while doing your assignment?
First of all, there's these laws that predate human rights, like the Penal Code provisions that we inherited from UK 1930. So what we are trying to do is to make the law aligned with the human rights, because almost all of our governments agree that we do need to advance human rights of people, in order to guarantee their health and life. But then we have these laws. So sometimes we have to bring the matter up, maybe in a court, to see how the conflict of laws is worked out. So that then we can align all these laws that regulate our social conduct in accordance with human rights. Okay? But that is a challenge. Another thing, though, is that in Malawi, we do have a law that is aligned to human rights. It's called the Gender Equality Act, which actually provides for sexual and reproductive health and rights, according to the modern understanding of human rights. But it is made subject to a law that is of colonial times. So what do we do with that? So if we go to Parliament and ask, can you change the law? Sometimes Parliament is dilly-dallying. If we go to the executive are keeping quiet. That's why we say, okay, let's turn to the other branch of government whose task is to interpret the law, okay, to address the conflicts with the law. That's why then we engage in what we call public interest litigation, because it's litigation that is for the public. It's for a public good to understand how these laws will be aligned with the human rights that we're talking about. Yeah. Because you remember at the end of the day that human rights is also about development of the country.
Yeah. We'll get to the courts a little bit, but let's go to something that you mentioned earlier, and that's the subject of inheriting laws that were never made by us. The Penal Code, I mean, it goes back to centuries, 19th century sometimes. Many of African countries have kept these laws in our law books. How important is it for us to decolonize our legal and policy framework in Africa? And how is it like in Malawi?
Yeah, well, I was, making this argument before the parliamentarians that, these laws were made in a particular context, all right? And things have changed down the line, and we also need to review them to adapt them to our context. The language that the law uses is reflecting the 1930s, even before that. So while our parliamentarians have been, dilly-dallying to look at the law, but I've emphasized that, well, let us review it. And I was even challenging them to say, even if we were to review, seriously consider it, and made the very same law that we have, at least we would have considered it.
Yeah, I mean, most of cases around sexual reproductive health and rights have been criminalized under the Penal Code.
Yeah.
In most of our countries.
Yeah.
And there are conversations that we need to start having, very serious conversations with that Penal Code, or with those clauses within the Penal Code, to reflect the current environment.
Yes, and as I said, that we have all subscribed to the human rights regime. We have all ratified these treaties, which say nice things about how we need to respect the right to health and life. I think our laws should align with that. So those laws that predate the modern human rights era should be reformed, reviewed, in order to be aligned with human rights.
What has it been like for you and the Nyale Institute to litigate issues or cases around sexual reproductive health and rights in Malawi?
Yeah. So first of all, because these issues used to be private, to be regulated by culture or religion, it is rather tricky to bring them in the public domain, because you find that there isn't specific, the rules are not specific enough as in other legal areas. So we have to now find ways, creative ways in which we bring them even before the court. Because when they appear before we appear before the judges are also sometimes, facing new things. So we have to be creative in how we articulate these issues that used to be private in the public domain, in order for the courts now to take this up in a way that will assist us. Mm-hmm. So that is one of the challenges. But this another thing also is that, we need a client to litigate these cases. So sometimes girls and women are a little bit scared because we have got an adversarial process. Because if you want to challenge or to interpret the law, the court will say, well, you have to bring a client who can demonstrate that their rights have been violated. So if we have this 13-year-old girl, for example, the case that we are trying to litigate, a 13-year-old girl was raped, became pregnant, and was denied what we think is a legal abortion, because our law allows that when you have a risky pregnancy, you can terminate. So we ask her that, well, your rights have been violated. Can we take it before the court? But then she asks, okay, how is the process? Well, we have to sue the doctors and the Attorney General who is going to defend the case. Then they can become a little bit intimidated, because look at us, and then you say the other side is the Attorney General. So we have to really try and convince them that, well, this is how the process works, that we have to go against the Attorney General, but that's the role of the court to balance the power, so that you don't have to fear that we'll assist you, we'll facilitate talking to the Attorney General. Because at the end of the day, we should recognize that litigation is a dialogue. What the courts try to do is to balance the power so that you should not be treated unfairly just because maybe you don't have money or you are not as powerful as the government on the other side.
Yeah.
So that dialogue should be balanced. That's why we have to take these matters before the courts.
Yeah, but even when you take them before the courts, or when you go before these judges, most of them are anchored in, they're just part of the social construct. And I keep saying this, they're religious, they are bound by their culture, norms, and values. Even when you present the data and the facts before them, I know, for example, in Uganda, where we know the cases of abortions that happen every year and its impact on post-abortion care and the money that we spend on that. And yet, both the legislature and some members of the judiciary, incline more on their cultural and religious connotations and perhaps may not even want to hear anything about that. How is the Nyale Institute engaging the judiciary to come with an open mind to listen to these cases?
Okay, maybe two things. First, we also we haven't done that much ourselves yet, but we need to engage the judges outside the court, okay? Because in the African region, you can see that there's a kind of a development of, the jurisprudence is being developed. In Kenya, you can see that there's certain progressive judgments. Even here in Uganda, some judges are making progressive judgments. So we need that the judges also learn from each other, among the peers. Because, when you I invite a judge to train them, they look up, who are you to train us? But if we get judges from Uganda and Kenya to talk to the judges in Malawi, then they will listen to one another. That's the first thing. But then the second is also that we are trying to do out-of-court advocacy with the public. Because at the end of the day, the people must demand. The grassroots themselves must articulate what they need. So a kind of public opinion, public court, so that the judges, they should be hearing out there that the people want this. The people understand their rights. So that can also be something that can motivate judges so that they should not be clinging to their own traditional thinking because, they're supposed to serve the people, not to serve themselves. So I think those are the kind of strategies we're using to try and still make gains while knowing that judges may have their own biases.
Yeah, and maybe these biases need to be deconstructed. One of the biggest challenges that people are doing work like you, and I've talked to many of them, they argue that there's a section of the public and the policymakers and influential members of society that issues around sexual reproductive health and rights are not African issues, that they are European issues, and they look at it as the European culture, trying to bring the European culture into the African culture. Have you encountered that, and how have you been able to clarify on this issue?
Yes, we have encountered those kind of arguments, but sometimes what I ask people is, we have undertaken research to understand what is the behavior of our women, and what we find out is that if you deny them access to safe abortion in the public hospitals, they just go elsewhere. Okay? They'll go elsewhere, they will use herbs, they will use people who are not trained to get an abortion. So the question I'm asking is that a European women seeking an abortion? Our very women want the abortion. That is why they are going around the institution. In fact, the women are subverting the process, But because of the gender dynamics there, sometimes the women who want to terminate the pregnancy, but they will not say it publicly. So for me, my work is just really to help those women who may not be able to say it publicly. First of all, that their voice may rise up. And second of all, when they want to access the services, at least they must be safe services, you see? So I think that the argument that this is Western, it beats me. Why is it a Western argument when our own women are the ones seeking the termination? Has anybody from the West come and told them that you go and terminate pregnancy? No.
Yeah, and this narrative is widely used by those against.
Yeah, I know that it is and then again, when we look at our laws, those laws which we're talking about, that they were created in a parliament that was not ours. Maybe they were created in 1929, you know. So the laws are not ours. And how do you tell me that our desire to reform these laws then is Western? So I think there's a little bit of the logic is not right there to argue that these are Western, first of all, because our women are the ones who are going to terminate pregnancy. And secondly, we are still dealing with the laws that came from outside our context.
Any success stories that you want to share from the Nyale Institute's work to perhaps reshape the legal and policy framework in Malawi?
Yeah, I can share one. So we did this litigation in 2021 where a 15-year-old girl was sexually abused, became pregnant, and when she went to the hospital, she was denied a termination. Then we instituted a judicial review to review the decision of the health provider refusing her a termination of pregnancy, which we thought she was entitled to under the law. So it went before the court. We had a technical hiccup because typically these women or girls precluded from even asking for a termination. So we couldn't demonstrate, or she couldn't demonstrate that there was a decision made by the doctor, because the doctor didn't even write in the health whatever booklet. But the court still made an explanation of the law to say that this clause, which says termination of pregnancy is available to save a woman's life, actually means mental and physical health, one. Secondly, the court said if a woman or girl has a reason to believe that the pregnancy is risky, then they must approach a doctor, which is also something that, society didn't sort of think of it this way. Well, but we did not get the judicial review. So this was a ruling that we thought, the judge has said nice things, but it's not binding on the executive. Surprisingly, Malawi is submitting its report before the United Nations Committee on Economic, Social, and Cultural Rights, because we ratified that convention. When the government was asked about abortion, it made a reference to the judgment, to the ruling. It said, abortion in Malawi is available on this ground and on the ground of life, which means mental and physical health. And then any woman who wants to, address a risky pregnancy should see a doctor. Exactly citing what the court said. So now this is a public affirmation of access to safe abortion for Malawi, even if it is on limited ground. So for us, that is really success. It shows that even if litigation may not be like a win, but whatever is said by the court can be taken seriously by the government. So we are now our advocacy now is to get the government to make that operational. So, you said it at the UN. So what we are going to do is we're going to tell the women that when you need an abortion because your pregnancy is risky, go meet the doctors. Now, if the doctors don't attend to them, then there will be further litigation, So I think that can be, that is for us actually a success story.
I spoke to a high court judge from Malawi, and I was telling him that even when the judiciary is supposed to interpret the laws, they also have a moral responsibility to give guidance based on evidence and facts.
Yeah.
And I think that should be the place of the judiciary, not to only interpret the laws, but also look at the facts available and give some guidance.
Yes. And of course, as in our litigation, we also assist the judges by bringing the facts, by preparing our submissions in such a way that then the court will get the best guidance from them.
What does the future look like for issues of litigation of sexual reproductive health and rights in Malawi?
Yeah, I think that You know, when I came to attend this meeting, just hearing from colleagues how they are doing, the struggles and working together, I think for me the future is in working together, the collaboration. You know, that when we are working in Malawi, not feeling like, we have to deal with all the pressures ourselves. For instance, we are supporting, there's a certain legal counsel who asked me to assist in giving them the material in order that she might deal with the arguments before the court. And guess what? I'm asking my colleagues in Kenya to say, and Uganda, say, can you share that material? Because we have not yet developed our litigation as we've done. So that working together, that collaboration, strengthening that across the region, so that it's a movement in the region, I think is going to be powerful.
Wow.
Yeah.
Where do we go from here?
Well, I go back to Malawi strengthened to litigate more. There's a case in court that we are litigating. So we hope that by the end of the year, you hear something positive.
Yeah. You talked about collaboration. I wanted to emphasize, would it be okay if, the legal teams from here working together, the legal teams from all over the continent, to put up, a fight for these rights, for example?
Yeah.
Is that a great opportunity to explore?
Yeah, I think they can, we can litigate like in our country and we get the help of others, but we can also take it to the region and work together on, pitching this at the regional level and maybe at the international level. So I think certainly the collaboration there is going to be important. Even as I was talking about how we work with our judges, if a certain country is making movement and we all learn along, then we hope that that country also pulls us progressively. So I think that collaborating in the region is going to be key, much as we are working individually in our countries.
Do you think these issues need to be brought to the attention of the African Union at a broader level? I know that each countries have their, legal and policy framework around that. But what can we do to elevate it beyond just the individual African countries to create some sort of, legal backing at the African Union level?
So we might have to do some more advocacy because you see, we were just hearing from the commissioner, the judge from Zambia, that we should remember that the countries have to ratify the necessary instrument in order for us to bring the issues before the court. Because if you don't ratify that, then the African court cannot take up our matters. So we have to check, have we ratified this? If there's a country that is ratified, can we tell our other countries that, look, there's actually a country that has ratified, so that they may be subject to the jurisdiction of that court. So we have to look into that. And obviously, when that has happened, then we can now bring the matters at the AU.
I understand. Yeah. I think it would be important. Yeah. When you play ball at that level, there is, some level of hope and perhaps even pressure.
Yeah, certainly.
The African Union.
Yeah.
Because one of the reasons I find our lawmakers very, for lack of a better word, what can I say? Because we present evidence. For example, the issues of abortion. There's overwhelming evidence in terms of numbers. Reports that are done by government, actually. The expenditure on post-abortion care in government hospitals. This is all evidence that can be presented to say, look, for example, Malawi, the law is restrictive, a bit tight, on for example, cases like abortion. But they know it.
Yeah, we do, and we have the data. Yeah. We have the data and the evidence. So
why don't they actually work with the evidence?
Well, maybe we go back to talk about that. Maybe there's fear to talk about these issues. There's restrictions, there's biases, there's the other side who are also telling the government to not take any action. So, that's why we need to do the advocacy, I suppose.
But for how long when there is evidence?
I don't know.
Maybe that's...
we will see as we go. But I hope that we can also learn how to do this advocacy better, so that we can be, impactful. We can convince, our governments to take the necessary change.
Thank you very much, Dr. Godfrey Kangaude. Thank you very much for speaking to us.
All right, welcome.
All right, been speaking with Dr. Godfrey Kangaude, who is the founder of the Nyale Institute based in Malawi. It is focusing on litigating issues around sexual reproductive health and rights. Again, this is the Ahaki podcast, and we are sharing experiences on litigating issues of sexual reproductive health and rights in Africa. I'm Solomon Terwanja. Catch you on the next episode.